Do you remember when Alice in Wonderland says, "I know who I was when I got up this morning, but I think I must have been changed several times since then." If you have a baby in the house, you might know this feeling. You might be confused and distressed. You might be exhausted to the bone or really worried about what's going on with your baby. You might be so tired you can't get out of the house, or unable to fall back to sleep when the baby wakes in the night.
Acceptance and commitment therapy, referred to as ACT, is an exciting new form of cognitive behavioural therapy that's particularly helpful for protecting our mental health when we have a baby. We can use ACT anytime, anywhere, and even better, we can't fail at it.
I'm Pam Douglas. I'm a GP, researcher and educator who specialises in a new approach to helping families with babies that's called Neuroprotective Developmental Care, or the POSSUMS programs. So I've found acceptance and commitment therapy very helpful in my own life, and ACT now has an impressive evidence base demonstrating its benefits. So this is why we've integrated ACT into all our programs for breastfeeding, sleep and baby cry-fuss problems.
I'm Deb Spink, and although I started out as a physiotherapist, for many years now I've been a consumer advocate for perinatal mental health. Back when I was a young mum, I faced some really significant mental health challenges. I believe that much of the distress I experienced in those years was preventable. And that's why I'm just so passionate about helping to support the psychological well-being of new parents. These days, I also coordinate the POSSUMS PIPS program. This is where other parents connect up with each other and have access to a wealth of online resources.
Learning ACT is a bit like practicing the guitar. It takes time to become good at it. We just have to do a little bit each day, really whenever we remember.
Move our arms. Can we move our arms? Yes, look how wide awake you are. What you doing? What you do? Oh, yeah, you want some more? You want some more? Where's Mummy's other hand? Yeah. Ready? Wow!
From an evolutionary point of view, the human brain is a brilliant problem-solving machine, thinking quickly to protect us from threats like predators or starvation. But the downside to this in the 21st century is that our human brain has a tendency to narrow down its attention onto the perceived problem and urgently try to solve it day and night, on and on. Does this sound familiar? I certainly know what it's like to have an unhelpful, busy brain talking to me all the time. And a woman's brain is hardwired to be worried about her baby after birth. When we have a baby in the house, that tiny, infinitely precious little being, our brains often go into overdrive, trying to solve every little problem in order to protect us and the baby. The brain's actually trying really hard to be helpful. But if we believe what's going on inside the brain, we can become very, very miserable.
When I had my babies, my brain was talking to me all the time with thoughts like, I'm no good at this, I can't do this for one more minute, my child is going to be scarred for life because of me, everyone thinks I'm fat and ugly, everyone can see I'm a bad mother because my baby's crying and I can't stop it. No one cares about what's happening to me and nobody wants to help me.
Jay.
In our world, we get lots of messages to suggest that there's something wrong with us if we're not filled with positive thoughts and living a successful, happy life. However, in truth, everything that really matters in life will sometimes bring feelings of joy and satisfaction, for sure, but also, inevitably, lots of unpleasant feelings, including emotional pain. This is very true of an undertaking as incredibly important as having a baby.
Yeah, I used to believe that because I wasn't enjoying my baby, because I had all of these awful thoughts, that I was even more of a failure.
So it's normal to have very unhelpful thoughts and painful feelings in challenging situations. What matters is that we don't let these thoughts and feelings control how we live our lives with our baby. The ACT strategies we offer you in this film will help your days and nights with your baby be as enjoyable and satisfying as possible, even though there will still be tough times.
Are you jumping? You jumping? Jumping? Jumping?